This Medical Minute, sponsored by Avera.
With the start of fall, health experts are turning their attention to vaccinations to get ready for another flu season.
Coupled with the flu, COVID-19 cases have still been prevalent. Sam Price spoke with an Avera family medicine physician about preventing respiratory illnesses.
You said we're kind of moving away from the term booster shots, and instead is it simply just one shot essentially, or should people be preparing for multiple shots in any capacity?
So for most people, it's going to be one shot. If you're an adult or 5 and over, you just need one shot with this new COVID shot that's come out now. For younger kids, it takes a little while for that immunity to build up, and so they're still recommending for kids under 5. In COVID, you can start getting it at 6 months of age as far as the vaccine. So from 6 months of age up to age 5. Then they're going to recommend doing a series. If for Pfizer, that's a 3-part series. Moderna, it's a 2-part series. And if kids have already started one of those series, at least one shot is recommended to be this new monovalent vaccine that's coming out.
And with that season approaching, is there a sweet spot for people that should get that shot, whether earlier or later?
I think it maybe depends. For influenza, I generally say, try to do it the end of September into October. If you get to Thanksgiving, if you get to Halloween, that's usually too late. So that's kind of the time frame there. For COVID, just because we're starting to see a bump already in the number of COVID cases that are out there, I would not delay it. I would tell patients and people to get in as soon as they can here within the next week, as the vaccine is going to become available in retail pharmacies, clinics, and so on.
For people that are getting that, any idea of the cost, or is that already going to be covered by insurance in most cases?
Yeah, in most cases, the new COVID vaccine is going to be covered by insurances. The nice thing is that the government is going to have it's called bridge access programs, where it's going to bridge people over the next year through December of 2024 for people that have no insurance or are underinsured. So there's going to be other ways for people to get a COVID vaccination. And then for children, they still have the Vaccine for Children program that allows coverage or payment for kids that don't have insurance or are underinsured. So, if you want a COVID shot, there's going to be a way to get it with little or no cost to people.
Now, for more information on vaccinations and staying ahead of those respiratory illnesses, visit avera.org/medicalminute. And we'll be right back.